it does this, we just have to wait. Hey, it's Sarah and
Glori.
And we are out here. I'm going to turn this around. We are across the street. There's our office. And we are at, oh, bummer, you can't really see it. Main Street Animal Hospital, which is right next door to us. And we are about to meet our neighbors. So we're going to go inside. So here we go.
Hi guys.
Hi.
So just to let you know that we're really big on teeth cleaning too. So we even have stuff to help clients brush their dog's teeth or at least improve the breath and improve the dental health until we can get them in for a dental. Because the dogs don't really like to brush your teeth.
Okay, so I have to know, is dog toothpaste, is it like bacon flavored or?
Usually, they have a couple different ones. They have poultry is the one that seems to be the most popular. I think they have a fish one for cats, which I don't think I've seen anybody ever buy. So most of it, I think poultry is the big one. I'm not positive on that. So we tend to use like MaxiGuard, which are the zinc gluconate sprays, and they really do a good job on getting rid of bad breath, but they really don't taste that great.
Okay. And you just practiced in April,
Yes,
but you've been up here for the last 2.5 years?
Yep, I started working for this practice in 2014, and then I just bought it just this April, and so of course it was the crazy busy time of season, so we're still doing last minute changes and modifying things, but the staff is good, and they've been here longer than me, and I think that's all I can think of.
Well, Dr. Sorensen, we want to thank you for your time. Here's a gift for
Cool.
you today.
Thank you.
Yeah.
Oh, we got a little, it's got little footprints on it too.
It's
Awesome.
perfect.
It's for our scale, huh? Or we could do it right there.
For whatever you want.
I like it. All right.
So we'll kind of walk through. She'll
right.
show us a couple of rooms, and then
I'm
we'll
going to set this here, not to be mean. I just thought you probably didn't want to see it on camera. All right. So as most of our clients come in, we go ahead and get them weighed, and the girls are checking them in over here, and then we'll come, depending on which room they go in, we'll bring them in over this way just to avoid a few people tripping. And so here's one of our exam rooms, and we do have x-ray viewers, and then this particular room we can look at the digital x-rays in here. I don't have them turned on correctly, or right this second, but, and it's a nice spacious room. We can close the door, big enough table. Most of the time I'm sitting on the floor with the dogs, so. And sometimes they lick my face, and well, most of the time they lick my face. So we'll come on back here to our treatment area. We have surgery, and we have our x-ray area, and then our major treatment area. And today, do we want to go see babies first?
Yes.
I'm going to distract everybody off of it. Okay, and we have a special treat today. We have a newborn kitty for me that came in. The lady that shows up at her house when she's pregnant, and she just finished adopting and spaying the kittens that were just born. So she brought her in, and she said she just showed up, and if I take her home, she's going to have kittens, and then she takes off. So I said I'd keep her here. We'd spay her after she had her kittens, and she had kittens on Sunday. So we have cute 3 little baby kittens. Let's go see them. So we don't have a name for Mom yet. She's fairly nice.
Hi, I know it. It's okay. We're just going to show your cute little babies off, okay? Can we show them? Okay, so we have a little,
They were eating, sorry.
so we got a little calico. He's so cute.
Super cute.
Eyes are still closed and everything. How
Yep.
adorable.
Yes, they're very cute right now. Well, they get cuter. All right, well, let's see. Everybody.
Oh. All right, we lost our Wi-Fi for a minute, but we are back. We're going to brush some teeth. That's a big dog, Danielle. Is that your dog?
This is Denali. She's a
Nice.
9-year-old boxer mix.
Wow.
Denali's a nice
You should brush your dog's teeth at least once a week. Not all of us are great at it.
Really, I should be brushing my dog's teeth once a week.
At least once a week.
I did
It's
not know
hard.
that.
But once you get them used to it, they do really well.
Can I use my Payson Premier Dental toothbrush on my dog too?
You can, because we do. Just make sure you use dog-friendly toothpaste.
They don't need fluoride.
So you can just brush all around. Like you would brush a 2-year-old's teeth, because they're not very cooperative.
Should still do
That's
circles.
funny.
How cute. That's adorable.
Denali's a good girl.
Huh. You just
You'll
can't
get
really do
more
the
adventures
insides
than
very
you
well.
Yeah, that's the
Yes,
best part.
I would think. So now, when you really clean a dog's teeth, though, you put them to sleep, right?
Yes, we put them, pardon me, we put them under anesthesia,
Mm-hmm.
and then we scale the teeth because they get much more calcified tartar than hopefully we do. And we'll scale the teeth, and then we go by with a probe, just like our hygienists do, and see if we have any deep pockets or teeth that are mobile that we need to take care of. One of the big things with the dogs, especially if they're chewers, is they'll get slab fractures on their big molars, the carneals. And so that's usually the ones we see the most often. Although one of our patients today lost a canine. So that's, and then let's see, what do we do after we scale them?
Polish and polish.
So we do a polish, and then we rinse out all the prophy paste in there, so that it's not going to help set up any tartar to start. And also the dogs don't really particularly like the fruit flavors.
Mm-hmm.
And then as we're waking them up and we're making sure everything's going well, it's always nice when they get a dental and don't have to get extractions.
Mm-hmm.
But unfortunately, we see more extractions up here than not. But so, and you're gonna brush.
Sure.
Here, I'll move
I'm
this
Tiara.
one.
This is Alice. I'm going to try to brush her teeth. And she is missing one of her canines on the bottom. She broke it completely in half, so I don't know how it's going to... I know.
She's good for mom. And she has beautiful
So
teeth.
this is your dog?
This is my Aussie, yeah. She's about 3 years old now.
She is adorable.
Thank you. She's doing pretty good for it. This is her first teeth brush.
She's really doing good. I'm not sure my dog would.
Good. So is this bad to
Still.
say I never brushed my dog's
Me
teeth?
either.
I didn't know you were supposed to.
You know, we played poker once, and the bet was for Dr. Wade. If she lost, she would have to brush our dog's teeth. I don't think she ever did.
Oh, did she lose?
Yeah, she
Oh,
did.
well, you better get her up again.
Well, bad teeth can lead to
Yeah,
disease,
heart
kidney
murmurs,
disease,
kidney disease.
So just
I mean,
like
and
people, huh?
Just like
we,
people.
yeah, just like, yeah,
Just
we should
like
know that.
us.
And it is Dental Hygiene Month this month, October.
It's actually
October
February.
is dental hygiene month?
Yes,
What?
it is.
It's February for dogs.
Yeah.
Oh, is it?
Oh.
For humans.
That's funny.
Okay, so let's see how Gail does, because I can tell you I don't brush her teeth. I typically bring mine in for, I can scale them at home sometimes, and then many times I get them in for a dental. Unfortunately, what usually happens when I bring my dogs and I have them scheduled, the day goes crazy and my dog's just got a little pre-anesthesia. Okay, everybody see, she's 5, so she has a little bit of tartar on her canine.
So, all right, let's see how you do. Are you going to be good for this?
Wow.
I don't know about this.
So Dr. Sorensen, Ron said, he commented, he said, "Hi, you're awesome."
Well, I hope so. It's possibly my husband, Ron, but it might
Yeah.
be one of our
Ron
clients.
Sorensen. No, it's
Yep, that's my hubby.
So you guys make it look easy.
Well, it's not always easy.
We just have good dogs.
Yeah.
I think you should try your little squirt dog.
Oh. It's a challenge.
See, now she has, you know what, let me grab her first. Stay. We'll see how well she listens. Oh, there's not.
Hi, Glori. Hi. Who knew? Brush your dog's teeth. I know now.
Come here, baby girlfriend. Come on, come here. Come here. This way.
So if we're probing them,
Oh.
we're looking, you know, she actually has pretty good incisors. She's got a little bit of, whoa, yeah, I think that one hurt. Yep, so she needs to go get a dental. She's got a nice pocket right here on this incisor. Looks like she's cracked it a little bit.
Oh, wow.
And canines actually look pretty good. Now, we typically only probe them when they're under anesthesia because you saw that hurt.
Yeah.
So, see, and of course, I've made them irritated because I just brushed them today.
So, and in case you're wondering, this is what Letitia does when she's checking your numbers.
Yes.
Lay there and you hear the 232, 232.
Yeah, 232. I try to keep track, but it never works for me. So I'm looking for deeper pockets that make me tell that a tooth isn't viable. And like this big carnassial, this is the one they usually get a fracture, and they'll get a fracture like right along here. And sometimes when I see them, even for a vaccine appointment, this piece is missing, and so it's open to the pulp. So we see that a lot. I see this side. She's like, I'm not sure I want to be good. She's being pretty good, though. So not too bad.
I think she's being really good.
Yeah.
So too.
And sometimes these little guys, they'll get what we call furcations, where they'll get enough gum recession that we can pass the probe right through where the roots are. And that tooth isn't doing them any good at all. So I didn't even notice that she had an owie one here. So she gets to have a dental soon. Now, if you look, she is actually, oh, I thought she maybe got him really late. She did get him really late. This is the only dog I've ever, big dog that I've ever had that had a retained canine. And she didn't get these last two until she was like 6 months old. So she always looks like she had a big space between her teeth. Because they have 6 incisors. Huh, you are very good. He's a good girl. Yes, let me finish brushing and then I'll let you go. What do you think? I have a really cool dog toothbrush that's angled that makes this a little easier. It would be better if I used it more. Sorry.
You guys want to try brushing teeth?
Glori? Glori, do you want to try brushing teeth?
I guess so.
Go for it, Glori.
Okay, I'm a little nervous.
We'll give you a challenge.
Okay.
I love it.
Fun.
So, Glori, Anya just started watching, and Anya's on vacation. So, hi, Anya.
Hi, Anya. Hope you're having a
miss
good
you.
time.
I know.
Okay, so I do have my coronal polishing certificate, but I didn't teach anything about dogs.
Well, that's the hard part. She's a wiggle meister. Here, you got a toothbrush?
It's funny because you're using all the same terminology.
I know the
Yeah, it's all the
furcation
same.
and
Yeah.
everything. Okay. So, can you brush your teeth and smell it? Would you like it? Let's see. She's gonna eat it. Can you brush your teeth? That's what I have to do to my son. Say, what's in there? Little dog biscuits. Liver flavored.
Probably.
She's like, this is not
You
fair.
guys make it look so easy.
She's actually being really good.
She's being really good for her.
Yeah, brush. That was good, huh?
I don't know about this.
Ooh, what about this one? What about this one? Let's see.
I think the only
You
time we
gotta
ever
do
get
that
the
side.
insides is you end up letting them chew on the brush.
So, now what about all these dog treats that advertise they help to clean the dog's teeth? Do they really?
Some of them do. The ones that have the enzymatic coatings on it will actually
You
help
want more toothpaste?
change the pH and help enzymatically break down some of that tartar. The big thing with the dog's tartar is they're not brushing their teeth like we do after we have, a peanut butter sandwich. You think, oh my gosh, my mouth is all gross. So you go brush your teeth to get everything out. They don't do that. So we end up seeing these great big calcifications on the back molars because they just let it sit there. The nice thing is, as our dental hygienists like, and I like it as a doctor, is when you pop that tartar off, the teeth looks nice and pretty and clean. But not all of them do that. Some of them have very greasy tartar that you have to kind of just scale off a little bit at a time. But it's great if we can get people to teach their dogs when they're young to brush their teeth. But that doesn't always work, and we're all busy. And if they were brushing their teeth, they had to brush the dog's teeth. She would sit on the toilet and wait for him. So she could only brush her own teeth if she put the dog outside.
That's cute.
And I had one client in the valley that had a cat that he brushed her teeth every day, and she was 10 years old, and there wasn't tartar at all. She had the most gorgeous teeth, and it was a really awesome experience. But not every cat is going to let you do that, and not every dog is going to let you do that. So if you start them as puppies with like a a gauze sponge or a washcloth and just kind of do circles like you do with little kind of kids, and try to get them used to you being in their mouth. That helps. And those that are older and are already having some trouble, we usually will do things like the MaxiGuard spray or the gel to just get it in their mouth. And it doesn't taste as bad as Listerine, but it smells way better than it tastes. But it does really soak into the gums, and it slowly releases, so it'll clean the mouth up. It won't take the tartar off, but it'll make them more comfortable while we have on antibiotics until we can get them in for a dental. And there's many of them. I think last week we had one that lost about 20 teeth.
Oh,
So, and they go home looking a little hillbilly, but many times I've seen them eat that night. They'll eat hard food that night, but because I think the teeth were so uncomfortable, because they were either really mobile or they just had a lot of tartar and a lot of infection in them, that they feel so much better even after you've just taken teeth out. It always surprises me, and we've had a few of the cats especially, and cat teeth are even less fun than the dog teeth, because as you try to extract them, many times they'll break. They break right at the gum line. And they're really bad about getting cavities right at the gum line instead of on the crown like some of the other animals. So I thought, what was the one we took the most out of lately? Kitty cat.
The name, Boots is what I can remember.
Yeah,
There
and
was one after that.
we
though.
took, I think we took like,
Boots, I think we took all his teeth.
yeah, he had other issues with his teeth, but the last one I remember specifically was, I think we took about 6 to 8 teeth out. And they have a little less than dogs, but, and I think they feel a lot better. And like I said, I've seen some of them be real nice and crabby. And once you get those nasty teeth out and get the mouth filled up, they look like they feel more comfortable. They look like they're a nicer cat at home. And if you're worried, if your dog or cat has a problem, watch them when they yawn, especially the cats. If they yawn and they got a bad tooth, they'll kind of do that. And they're exposing that open root.
Oh.
We'll see that one a lot. And like I said, you saw it didn't hurt my dog to do this, but you saw what she did when I touched a tooth that was bad. She flinched.
Yeah.
And I never want to do that in a room with a client. I've had classmates that always poked him, and I'm like, I just feel like it's poking the bruise that already hurts. So if I can see it, I just say, I don't want to probe him. Let's get him on antibiotics. Let's try to make this feel better, and let's get him in and get the bad ones out of there. And we don't prefer root canals here. I can send them to someone that does root canals. Dr. Visser and his group have a veterinary dental place down in the valley, and they do lots of interesting things. And whether it's bone surgery to take advantage of, a loss of a tumor or something like that in the mouth, they'll take part of the mandible out, or they'll do root canals, and they'll do crowns sometimes. I've also, Dr. Visser's told me he'll do braces for him occasionally, but somebody has to really talk him into it. So
That's funny.
it's
Well,
not
I see
as
a
much
picture of
fun.
that.
Yeah, I know, huh? Well, I think we all learned something today. Brush your dog's teeth at least once a week, and you saw how they do it. Don't do it like I did it. And yeah, thank you so much for letting us come and look at your facility and meet your animals.
Well, that's wonderful, and this is not all of my animals, unfortunately. I just couldn't get them all in the car, so. But most of mine, well, the ducks and the chickens don't really have teeth I have to brush, so that works out for me. So. And the birds.
There we go. Okay.
Okay, thanks for watching, and we will have more to come. Have a great day.